Hello, we're here today with Sharon Eubanks. Sharon, thank you for being here.
Great to be here.
We're going to talk about the issues around tobacco and smoke-free environments for employees. And Sharon, you were involved in a very historic settlement with Big Tobacco. Would you just briefly let people know what your involvement with this issue is?
Well, actually, it's a case that's still going on today, oddly enough. In 1999, we filed a lawsuit against the major manufacturers of tobacco smoke and included in it a provision that dealt with secondhand smoke. This was new to litigation from the past. And what we looked at was the agencies, not the agencies, but the defendants' behavior, the cigarette companies, in manipulating the evidence of the harms of smoke-free, the harms of cigarette tobacco smoke, secondhand smoke, or as they like to call it, environmental tobacco smoke, because it was just in an environment, you know, it was okay. So we went through a 9-month trial in federal district court in D.C. and got a judgment from the court that found, among other things, that secondhand smoke is a Class A carcinogen, harmful to humans, and so that means that those of us who breathe, that would be all of us, deserve to be in a smoke-free environment. And I'm here to hopefully help Oklahoma along in that way.
Well, that's interesting that you say that, because I was going to ask you, was secondhand smoke really much of an issue? I mean, at some point, that became like, this is a serious issue for everyone. It's not just the person who's smoking the cigarette. It's affecting everyone.
Absolutely, and the companies had, in prior litigation, taken the position that it's a choice. Everyone knows smoking is harmful. We put warnings on the packages in 1964. But for the person who's standing next to someone and having to inhale that smoke, the company said, well, it's not really that dangerous. And they hired and trained their own writers of so-called studies to support those issues. But as it turns out, none of that's actually true. Class A carcinogen, harmful to humans when they breathe. I think 41,000 people a year are affected by secondhand smoke with disease and death. It's a huge problem, and no one should have to work in an environment where you have to breathe secondhand smoke.
The workspace obviously is a big issue, and there's probably some places where people work where it's worse than others. But where else do people have a high likelihood of being affected by secondhand smoke?
Well, I mean, in hotels, and people don't realize that even after the smoker has left the room, that there are studies that talk about third-hand smoke. But, I mean, the thing about smoke-free that we've seen in many other jurisdictions is that it's not just good for the health of the people, it's good for the community, it's good for business. It actually brings in businesses from out of state, because many businesses will only hold their meetings in places that are 100% smoke-free. So it's very important for Oklahoma to participate in this. I see this growth in Oklahoma City. I see the skyline coming up. That new convention center, all right? Who's going to come to that new convention center? Places, when it's a smoke-free Oklahoma, places will come and bring their business there. That's what's been shown in other places. I live outside of Washington, D.C. They opened up an MGM casino there. You know how when you go to Vegas, you're fighting through the smoke? Not so in this casino. You go through the casino, it's smoke-free. Guess what? There's still lots of people in there conducting their casino business.
So that's not harming. When people use that as an argument that it'd be bad for business, you're saying it's just the opposite.
It's just the opposite. Studies have shown this. I don't know if you remember in the early 90s when California said, it was one of the first states that said, we're going to go smoke-free here. In restaurants and bars. There's not going to be any smoking allowed. There's this great uproar of people saying, oh, it's going to hurt business. Well, guess what? It didn't. And that's, it helped business. And as I said, it's good for the health of the people, the patrons. It also is helpful because kids don't have the opportunity to walk in a bar and get started smoking. If you make smoking more difficult and less accessible for people, then pretty soon they'll get serious and maybe they will be able to quit. It helps them.
And so your message here, they've brought you to Oklahoma to help say, we need to get serious about this legislatively.
We do, and it's important to know who this industry is who's on the other side here. You would think everybody would be on the side of health. You'd think everybody would be on the side of good business, but everybody isn't. There are many sponsors, lobbyists who work for this industry, bringing out-of-state interest into Oklahoma to push for something that Oklahomans don't need. They want to write the legislation in such a way that doesn't really create a completely smoke-free environment for people, for restaurants, bars, and where people work and congregate. And that's been one of the problems with the existing law. It was written by the industry. We should stay away from that.
And it can be a powerful lobby.
It is a very powerful lobby because of the money that it has. But remember, that's outside money. That's money that's not doing anything for the economy here in Oklahoma. And it's not what the citizens of Oklahoma really can benefit from and become a healthier environment for everyone. And that's what's really important. These are companies who were found guilty of fraud on a massive scale over a 50-year period and continue to this day as racketeers to do their business. We should not listen to racketeers, or the legislators here in Oklahoma City should not listen to the voices of racketeers who tell them how to write the legislation that's helpful. Don't be fooled by that.
What can the average Oklahoman do to try to counter that?
They should contact their legislators. They should make it very clear of what they want, that they don't want tobacco writing their laws, that's not the kind of assistance that they need. They should make it clear. They can educate themselves. You can go online and see plenty of information, studies that were done, independent of the influence of the industry, that tell you that yes, it is harmful to you. It's not good for you. It will make you sick, and it can kill you as well.
All right. Well, Sharon Eubanks, thank you so much for coming to our studio today, and we look forward to hearing more from you.
Great to be here, Catherine.